Hi children, shall we discuss a new topic today? Before that, let us revise our previous class points. What we have discussed in the last class? We have discussed about communicable diseases. What do you mean by communicable diseases? The disease that spread from one person to another person. The disease that spread from one person to another person is known as communicable diseases. So diseases caused by microorganisms are called communicable diseases. About this we have studied in the last class well, and today we are going to see about non-communicable diseases. We are going to see about non-communicable diseases. Non-communicable diseases means that diseases do not spread from person to person. So communicable diseases that spread from one person to another person, but non-communicable diseases that do not spread from one person to another person, and communicable diseases that are caused because of microorganisms, but non-communicable diseases that is do not caused by microorganisms. Okay, and example for communicable diseases: COVID-19, tuberculosis, and example for non-communicable diseases: heart attack, stroke, cancer. These are the non-communicable diseases. So non-communicable diseases means the diseases that do not spread from one person to another person. So you no need to worry about the persons who have that non-communicable diseases, but those who have communicable diseases, we have to aware from them. Okay, so let us discuss non-communicable diseases in detail in the class. Hi children, in today's class we are going to discuss about non-communicable diseases and safety and first aid. So before that, let us revise our previous class once. What we have discussed in the previous class? We have discussed about communicable diseases. What do you mean by communicable diseases? The disease which is spread from one person to another person is known as communicable diseases. In that, we have seen about diseases caused by bacteria and diseases caused by virus. Okay, and diseases caused by bacteria are tuberculosis, cholera, typhoid, and diseases caused by virus: hepatitis, chickenpox, and rabies. So these are the diseases, and how it is spreading from one person to another person. What are the prevention? So everything we saw in the last class, and today we are going to see about non-communicable diseases and safety and first aid. What is non-communicable diseases? It is opposite to the communicable diseases. It is caused by eating food with less iron content and can also caused due to feeding some other foods instead of breast milk. Severe anemia in children may lead to hookworm infection, chronic diarrhea, and dysentery. In recent days, school-going children, especially the girls, are affected by anemia. The government of Tamil Nadu provides weekly iron folic tablets to all the girls in the schools of all areas. Okay, so non-communicable diseases. Non-communicable diseases means it is a disease that do not spread from one person to another person. So non-communicable disease, it is a disease that do not spread from one person to another person, and it won't be created by the microorganisms. Okay, there is no relationship between microorganisms and non-communicable diseases. Example: heart attack, cancer, headache, stroke are the examples for non-communicable diseases. This non-communicable diseases happens when with less iron content, so that only we have to eat iron rich food. Okay, so our body should feel healthy na. We have to eat Iron-rich food. What are the iron-rich food? Indian sorrel, pulichakira, moringa leaves, muringathala, dates, fig, attipalam. Okay, so these are the iron content food. These are the iron rich food. So if we have iron rich food, then our body is healthiest one. Okay, and due to the less iron content, only the children, mainly girls, they are affecting by anemia. So that only the government provides iron folic tablets to the school going girls. Okay, anemia means ratta sogai, rattam illama irukkirathu. Okay, so their skin will change into pale skin, PALE, pale skin. Pale skin na ஒரு மாதிரி வெளிரி போயிருக்கும், முகமெல்லாம் பிரைட்டாக இருக்காது, அங்கங்கே ஒயிட்டாக இருக்கிற மாதிரி கொஞ்சம் ஃபேடான மாதிரி இருக்கும். ஓகேங்களா. And next one, safety and first aid. Safety and first aid. So those who are met an accident or suddenly if they get heart attack means, so the persons who are nearby them, they have to give the first aid to them. Why for this first aid? To save the life, to prevent further bleeding and determine the condition of the patient, to relieve from the pain, to provide a medical care available at the earliest. Okay, one who affected by accident or sudden heart attack means we have to give first aid to them. Why we have to give first aid? To save their life, to prevent further bleeding. Okay, and we have to call them to the hospital. We have to call them to the hospital. And the person who are in a position of first aid, they feel happy. Yes, this person have come to save me. Like that they feel happy and they feel better. Okay, suppose no one goes near to him means he feel that yes, no one come to me, no one come closer to me, so I am going to die. Like that. So negative thought he will think. Okay, one they help them means he won't think negatively. Instead of that he think positively. Yes, this person save me. Like that he will think a positive way. Okay. And next one, burns and first aid. What do you mean by burns? The tissue damaged. Okay, the tissue damaged by heat, chemical, electricity, sunlight is known as burn. Okay, the tissue damaged by heat, chemical, electricity, sunlight is known as burn. Here we have 3 degrees of burn. First degree means a light burn, only the outer layer epidermis will get damaged, so easily it grow in certain time. And second degree burns, it is affecting the middle layer of epidermis. Okay, so it needs some time. And third degree of burn, so the complete epidermis layer is burnt, so that they need much days to recover. Okay, so what do you mean by burns? Burns means the tissue damaged by heat, chemical and electricity or sunlight is known as burn. And also fire. Okay, fire is included in heat. And in that 3 types of burns is there. Suppose this is our skin means here first layer what we see, the outer layer, that is called epidermis, and little bit inside means that is called a second degree of burn, and inside the epidermis means that is called third degree burns. Okay, so first degree means no problem, only few days only to take to recover, and second degree burns need some day to recover, and third degree of burn epidermis is completely damaged, so they need much time to recover. Okay, and what are the first aid can be done for the burns? For the minor burns, very small burn, we can clean it with the water and we can apply the antiseptic cream. Okay, if it is a minor burn, small burn, we can clean it with the cold water and we can apply the antiseptic cream. Okay, but when it is the major burn, okay, major burn, we have to call them to the hospital. Next one, cut and scratches and its first aid. So cut is nothing but it is a line of damage like this. Okay, it affects the skin. Cut na, it is a line of damage that affect the skin, and scratches does not affect the cell. Okay, scratches does not affect the cell. Okay, so cutna அந்த மாதிரி வெட்டுப்படுறது, scratches அப்படின்னா சரைச்சிருச்சுன்னு சொல்லுவாங்க இல்லையா. ஸோ சரைக்குது அப்படின்னு சொன்னால் வெறும் அந்த மேல் தோல் மட்டும்தான் அடிபட்டிருக்கும். ஸோ செல்லுக்கு எந்த டேமேஜஸும் நடந்திருக்காது. ஓகே, ஸோ டு யூ நோ த டிஃப்ரென்ஸ் பிட்வீன் பர்ன், கட், ஸ்க்ராச்சஸ். ஓகேவா? ஸோ இதில் கட் அப்படிங்கிறது லைன் ஆஃப் டேமேஜ் தட் அஃபெக்ட் த ஸ்கின். ஆனால் ஸ்க்ராச்சஸ் சரைச்சிருக்குன்னு சொல்கிறோம்ல, ஸோ தட் டஸ் நாட் அஃபெக்ட் த செல். ஓகேவா? அண்ட் பட் இட் கெட் ப்ளீடிங். ஆனால் என்ன ஆகும், ரெண்டுலேயுமே ப்ளீடிங் ஆகும். ஆனால் கட்டில் உங்களுக்கு அதிகமாகவே ப்ளீடிங் ஆகும், ஆனால் சிரைப்பில் அதிகமாக ப்ளீடிங் ஆகாது. ஓகே, blood won't be get wasted in the scratches. Now what first aid can be done for minor cut and major cut? Okay, so for the minor cut we have to apply cream or we have to cover the bandage like this to prevent the further bleeding. Okay, and for the major cut we have to call them to the hospital. Okay, and these are the first aid can be done. But while we are doing the first aid, we have to remember in our mind what means we have to wear gloves to help the first aid person. Suppose if they get HIV disease means or any communicable disease means that will easily attack us. So we have to wear mask and gloves to help the person. Okay, and we should not use sharp needle or any other sharp objects. Okay, because while we are using that we have to handle it with a very careful way, because if they get any communicable diseases then easily it will affect us. So these are the first aid can be done for the cut. Now recap what we have discussed in today's class. We have discussed about non-communicable diseases. What do you mean by non-communicable diseases? The disease that do not spread from one person to another person is known as non-communicable diseases. And example, heart attack, cancer, stroke, headache. These are the examples for non-communicable diseases. And non-communicable diseases do not spread by microorganisms, that you have to remember. Communicable diseases will spread by microorganisms, but non-communicable diseases do not spread by microorganisms. Why first aid is essential? To save our life, to save the people life who are affected by sudden accident or sudden heart attack. For them this first aid is essential because to save their life and to relieve from the pain, and they feel better. Yes, this person came to save me. And what is burns and what are the first aid can be done for it? Burns is nothing but the tissue get damaged. The tissue get damaged because of heat, chemical reaction, electricity and sunlight. Okay, and in that first degree of burn, second degree of burn, third degree of burn are there. First degree, just it is damaging the outer layer, so need nearly 1 week to clear. And the second degree of burn, it damages the middle layer of epidermis, so it need much time to recover. And third degree of burn, epidermis is completely burnt, so it need few months to recover. Okay, for minor burn we can do the first aid as we have to clean that with water and we can apply the antiseptic cream. but in the major cut or major burn, we have to call them to the hospital. So here this method can be followed for the first aid. Cool, call, cover, triple C. Okay, cooling for 20 minutes. Call to this number and cover with cotton cloth or band-aid. Cut and first aid. What do you mean by cut? It is a line of damage that affecting the skin. Scratches that do not affect the skin, or that do not, it affect the skin but there is no damage for the cells. Okay. And here also for the minor cut and scratches, we can clean it with the cold water and we can apply antiseptic cream. For major cut, we have to call them to the hospital. But keep it in your mind, while you are helping the people, you have to wear gloves and do not use a sharp needle or any other object directly, because if they get any communicable diseases like cholera, typhoid, hepatitis, chickenpox and HIV means it is easily transported to us. So while we are doing the first aid, we have to protect ourselves. Okay. So all over this lesson name is health and hygiene. If we follow the proper health, there is no doubt we are the hygienic people, and you should not avoid healthy things like healthy vegetables, healthy diet and healthy your heart, so that everything you should not miss it. If you are proper health, then you get a proper hygienic. You can proudly say that I am a proper hygienic person, and you no need to fear of any diseases, especially to coronavirus. Okay, I hope you understood this class well. Complete the homework. Thank you, children.